if you're a member, you get a dedicated nurse, a dedicated nutritionist, a dedicated mental health person, a team of doctors to be working with. And the goal of these people is really to keep you healthy. If you are, say, overweight, the goal of these people is to ensure that you reduce your weight to levels that are good for you.
Hi, everybody. I'd like to welcome you to the Nairobi Gold Rush Podcast. We have Julius Kabangi. And welcome, Julius, to the show. Very glad to have you. And Julius is a leader in healthcare tech. And maybe we'll just start out, Julius. Maybe you could tell us about your company and what you do here in Nairobi.
Thank you so much, Scott. I'm really excited to be here. Nairobi is, as they say in Swahili, Nairobi ni home. So I am a tech leader in a company by the name of Antara. I'm the CTO there. The work involves building the software and systems that enable people to receive best possible healthcare they can possibly get than what has been the norm.
Sure, and maybe tell us a little bit about what the product looks like. What when you say it helps people get good healthcare, like how does it at a high level? How does it operate?
So healthcare, in a nutshell, is such a large, it's a large industry in itself. So what we do, we build. So to begin with, the name of the company is Antara Health. We provide what we call proactive care, or rather what you'd call preventative healthcare, whereby we have systems behind the scene that are continually thinking about what should we be doing for XYZ member. If you are chronic, for instance, making sure that you receive your drugs on time. If you are, I'll give an example of someone who is hypertensive. A hypertensive person is someone who has high blood pressure. So this person needs continuous monitoring at home, meaning that we need to collect their blood pressure. And so on our end, we give them a system, an Antara application, or even an SMS, a WhatsApp line, and a call. And every time they take that the measurement, they feed it into our system. And then our system then is able to give them immediate feedback on the progression of their health. Behind the scene, we have then a pool of doctors, nurses, mental counselors, nutritionists that are then using that data to decipher what's the next step for this. We like to call our people members as opposed to patients to that member. And in that case, then, it makes it easier for someone to stay healthy as opposed to waiting for them to get retired. So that's what we call proactive care.
Sure. It sounds like a super advanced version of like a smartwatch or something where you're consistently able to provide the gadgets that are needed to collect the data about the people's health and then kind of give them recommendations real time. And I think with the people with the chronic conditions, that is super critical, right? If somebody has the blood pressure problems or maybe I don't know what other type of conditions you work with, right?
Yeah, there's so many of type of condition. In fact, before we even go to someone who is hypertensive, there was something that started off for them to get there. So really, it's not just people with chronic condition, really. It's everyone. Sure. Every single human is dealing with a condition. Sure. I could be dealing with a rash.
Right.
Or I could be dealing with persistent backache. And that's a symptom of something else that is building up over time.
Right.
So here, really, to pull back a bit again, we do what we call a screening of sorts. And that screening helps us understand why your grandmother, your father, did they have some sort of condition?
Sure.
So diabetes, for instance, is one of the conditions that sometimes, comes from the fact that your siblings or your grandparent had this condition. It means that you are at risk of having it.
Yeah.
So it's important for you then also to be receiving this proactive care for you to know what should you be doing today before you get to a place where you need to, you are pretty sick. So
Sure.
that proactive care. So there are so many diseases. We have diabetes, osteoarthritis, and so many other diseases.
I assume for somebody to get into healthcare, it's got to be a large passion for you.
Yes.
Was that what you say? Where does that passion come from? Maybe did it start when you were a little kid? Like maybe you could talk us through, where that passion for this industry came from.
Yeah, it's I would say for me it's a mission in so many ways, and as you've said, it comes from my experience um seeing these issues firsthand.
Uh-huh.
I'll go to my time, I think in high school, at the towards the end of high school. That was in the year 2008,
Yeah.
2009, roughly thereabout. And at the time, my mom was very sick, admitted in the hospital.
Yeah.
At the same time, again, there was this epidemic of HIV.
Uh-huh. Yeah.
I'm not saying my mom was HIV, but I'll come into that. And she was admitted for so long
Uh-huh.
in the hospital. And then after some time, she was let go. But then what appeared to be was that, she had TB, tuberculosis.
Uh-huh. Yes. Uh-huh.
And tuberculosis is that one of disease that makes people really look very thin because of the the nature of it.
Sure.
And at the time, again, I've talked about HIV was extremely high, and there was so much stigma around it.
Yes,
I
exactly.
remember feeling the shame of working with her just because of that.
Yes.
And after some time, again, TB is a disease that is airborne, that is transmitted
Sure.
through the particles of the air, and I got it as well.
Okay. Yeah.
So went. I remember going to school, and then going to school. Then I think I infected one of my deskmate, and then that deskmate sort of
The stigma worse, I guess.
exactly. Not just that. I remember when I went home after school, I remember going to the hospital immediately and saying to the doctor, "You please test for exactly this disease. I'm pretty sure I have it."
Yeah.
And they validated that. Then going back to school again, I told the guy, the deskmate has been going to hospital so many times, and they could not figure out what was going on.
Huh.
And only for me to tell him, if you go home and you test for this, you might happen to have TB.
Yeah. Like you're like, I know what I have already.
Exactly. And then this guy seems like, was like, "You guys are a witch."
Wow.
Yeah, and
Well, and I guess how treatable is TB? Once you find out that you have it, are there medications for it or?
there are medication for
Yeah.
it. But this medication, I think you take either a month or 2 months.
Yeah.
You have to be on drugs for at least either 1 month or 2 months. I don't.
Yeah, it's pretty serious medication. Yeah.
And you cannot miss it.
Yeah.
And again, here coming back to what we do at Antara is ensuring drug adherence, because
Yeah.
TB, if you miss to take these drugs over time, you then are at risk of getting building, issues around the antibiotics not working with you, and you get then a strain that is more severe than the previous TB.
Yeah.
So healthcare in that sense that is home to me, because I know the issues that comes about by not following the protocols preset by the experts around it.
Sure. So how did the TB situation, were you able to take the medicine, and how did your mom end up with the situation?
Yeah, I did take care. She got well for sure. But then at the time, then I remember, I said she was sick for an entire year.
Yeah,
give or
that's
take.
pretty tough. Yeah.
Which then meant that, over time, I was in and out of school because of school fees. She was really the breadwinner for me at the time.
Yeah.
Which then meant, for me, I was under very serious stress around the same time. So it really took a toll on me in so many ways, to the point where I remember getting highly, highly depressed around it.
Yeah.
And that really, sort of like branded the need for me to be more involved in healthcare space and doing more within that space.
Sure. Yeah, no, it's pretty interesting. I remember when I first started coming to East Africa. So I've lived here for 12 years. I have my permanent residence, everything. But I think about that time, 2008 maybe is when I started coming to this side. And when I went to the travel doctor before I came to East Africa, and I said, okay, I'm going to Kenya. And the lady's eyes, lit up wide, and she goes and gets this book that's like this thick, and it starts like telling me all the bad things that are going to happen to me when I come to Kenya. You're going to get malaria. You're going to get HIV, no, not HIV, but you're going to get all these crazy things, hepatitis B, C, D. And then they said, no, don't get. What's funny I found is like they're like, whatever you do, don't get dengue fever, and and the stigma was like so crazy, and so I remember the first time. And I came here and I was very concerned because the lady had told me all these bad things are going to happen to me, and I had to get all these injections, and I was so nervous about it. My wife grew up here. She moved here in 1983, and then went back to the States where we met. And she told me, "Don't worry about like the hepatitis, all this." She said, "As long as you don't touch feces, it'll be okay. Like as long as you're not, or don't need a blood transfusion or something, and you stay away from the feces." So I thought, okay, that's easy to do. I won't touch the feces. And the problem is I have bad eyesight. I was born with a bad eyesight condition. So the first thing, we're traveling down Mombasa Highway. We need to stop at the washroom. And I go into this washroom and I'm just walking around and feces up there all over my shoes, everywhere. And you can imagine that. Then I'm thinking, oh no, I have to clean all these feces up from myself. So, but yeah, I mean, there was this there's this crazy stigma, and what you realize is a lot of these things are either some are preventable, there's medication available for most of these conditions, I guess. It's not a gloom and doom situation. Yeah. But it is a very important thing because one of the things I was doing when I first came to Kenya is I was running children's homes for children with HIV. So half the children had HIV, half did not. And so what we would do is for the medical care purposes, we kind of had two dormitories, one for the HIV wing and one for the not the HIV wing. Really wasn't to separate the children, but it was to, the regimen of the medication. This group, they're in this building and they get their medication a certain way, and this other group would be done differently. But what I found funny about the stigma was like the ladies who would wash the clothes. They would hand wash the clothes, and then one time I decided to buy a clothes washing machine to make the clothes washing more efficient that both buildings could share. But they didn't want to share the clothes with the clothes washing machine. They didn't want to mix the building, or even the ladies who worked in the HIV wing. They wouldn't wash the clothes with the other ladies. So it was very, very interesting, very insightful. So I think, but these stigmas are around. So you experienced that kind of firsthand as you were growing up, then, I guess.
Yeah, it is quite serious. And actually, when you even pull back and think about it today, I think the stigmas are still there. For instance, I still believe if someone else who has never been Kenya wanting to come to Kenya, they will be very scared of the things they are being told about, things to be careful about, especially around disease and all that. Only for them to get here and be like, this is probably better than where I'm coming from.
Yeah, exactly. Well, I mean, what I understand in the U.S. where I come from is that to get healthcare, it's a long process and it's extremely expensive, and you can't see a primary care doctor. But I know what I do. I go to the hospital, and there's a guy I see who here in Kenya who's like they call it an internist. I go, he does the ultrasounds, the scans. Oh, you need an MRI? Just go here. Oh, you need to do a stress test on the treadmill. Whatever it is, they have these machines and everything, and I can get everything done. And I mean, of course, you have to deal with the long waits at the hospitals, but in a day you can be done very quickly.
Well, yes,
but it's expensive still.
There's so many elements of what you just said.
Yeah,
there's so many things that are packed there. If you think about how many people can really afford,
yes, exactly
that,
right?
It's very few.
Sure.
So actually, we like to say at our company that what we have today is a sick care.
Sure.
Not a healthcare in itself.
Right.
Because the healthcare is a preserve for the few that can afford it.
Yeah.
But majority of the people, including the upper class and the middle class, can really not afford it. So they still live in the world of sick care, where they only see the doctor when they are very sick.
Yes.
And at the time it's already too late. It's too expensive.
Yeah.
For things that if they took the proactiveness of it, would have been cheaper. Would have helped them stay away from the hospital in the first place. Yeah. Even saved time in the long run. And also coming back to the stigma component, majority of the issues there are where information is extremely fragmented around specific things, which then means that people then just believe their old beliefs of what they have heard or they have seen is still what sticks.
Yeah.
As opposed to them trying to understand what are these diseases, how do they come by, how do I prevent myself from receiving them, or how do I make sure my family, my extended community, I'll stay in healthier lives.
Yeah, I mean that's completely true, and I feel like a lot of times people here get misinformation from the doctors as well. An example that I saw is there's a guy that I was working with who was a gardener. He was doing the gardening outside, manual labor, and he injures his knee, lifting something, or he twists his knee. So he goes to the doctor and says, "My knee has a problem." And the doctor looks at him and he says, "Your problem is you're eating too much meat."
Mm-hmm.
And he says, "I eat meat once a month." I'm not making the money to eat meat. So the meat's not it's not the fact that I'm like lifting heavy objects and twisted my knee. It's so I feel like there's like this misinformation that happens with the doctors.
I'm not quite sure though, actually.
Yeah.
The doctor could have been right.
Yeah. Maybe
because it could be probably probably he thought this is someone who is at their old age, and arthritis issues and arthritis issues are starting to start back, so he could be right in that sense.
Yeah, sure.
But then the main challenge here is the fact that this person we are talking about, the patient in this scenario, is not well empowered enough to understand the various things that are going on,
right?
And as a result, they don't have the information that they need to attempt to understand the doctor's point.
Right. Well, I mean, you have to trust that what the doctor's saying in a way, right?
Yeah,
because they're the expert.
And actually, that's actually one of the major problems we have in healthcare as a whole, whereby people are not empowered with the right information to treat themselves. And you're in tech world, I'm in tech world.
Yeah.
We tend to build system from one hypothesis, then you nail down. Doctors is no different. They start from there. And I tend to believe also, we are ourselves, our own doctors first.
Yeah.
Before we go to the doctor.
Right.
The doctor is the secondary doctor to us.
Yeah.
And by that I mean we first know what we are feeling. We first know how we got to feeling that way and the symptoms and how it emanated. And the doctor can only work with the information they get from us.
Yeah.
And one of the challenges as a whole that we have, especially in Kenya and actually almost across the entire world, is fragmentation of healthcare.
Yeah.
Where if you went to the doctor, say 2 months ago, you probably went to Aga Khan in around Limuru Road. Yeah. And then later on you came to Karen Hospital.
Yeah.
Or you went to, all these systems are not talking to each other. And each doctor is having to start from ground zero.
Yeah.
And as a result, then what happens is what you're talking about, the feeling of misinformation. Second is misdiagnosis, because the historical build-up of your health is not available to all doctors.
Yeah.
And again, pulling back to what we do at Antara.
Yeah.
That's one of the value propositions.
So y'all are trying to kind of create connected data systems in a way over time, maybe?
Yes, and building referral. So one other thing I did not talk about is that at Antara we do a coordination of referral. Where if you're a member of Antara, if you go to another hospital, we are making sure we are coordinating that experience. If you go from that doctor to another, we are making sure that the documents are transmitting all the way back to the new doctor that you're going to see, and coordinating the referral process, as well as exposing the data that we are receiving from these respective hospitals and the medication you are getting back to you for you to see your trend over time.
Sure. Yeah. Well, that's a very helpful thing because, I think this misinformation or information not getting communicated, that's the difference between saving somebody's life or them getting fast healthcare. Because like you also was mentioning, like a lot of these things you need to treat very quickly, and it's you need to treat it before it becomes more serious, I guess. Like a lot of the stuff like the TB and things, if okay, I've got TB, you find that quickly, then it's not going to be as deadly as a situation.
Maybe let's actually talk about two diseases that are very common.
Yeah.
Statistically, and this is actually one of the thing I learned from my CEO, I think on Friday, where we were talking about by the year 2050, these are very scary figures. By the year 2050, half of the entire world will be obese.
Oh yes.
And
In the US, that's very true.
and this is the thing. Most of them will either have diabetes condition, or second will have hypertension.
Yeah.
In most cases,
Sure.
or they have a combination of both.
Right.
Today, if you look at for every 10 people today you get, if you count, if chances are 3 of those people in that group either have diabetes or have hypertension,
Yeah.
whether they know it or not.
Yeah. You say 3 out of 10 maybe, or
3 out of 10.
3 out of 10. Yeah.
So
Okay.
every 10 people you see,
Yeah.
3
Yeah.
out of that group certainly have
Diabetes or high.
either they're at risk or they already have it and they don't know about it.
Yeah.
And these two things are actually the major life crises that are coming up
Yeah.
in the present group.
Sure.
We are in the face of a crisis that is building up without us knowing. And actually, pull here back a bit and look at what the government was doing a while back by building this. They're calling health promoter thing. I think we call it health community promoter, something along that line, where they were giving people toolkits to go around and measuring people. And this actually the realization that these two conditions, if not properly managed, if people are not well educated about them, it will be a health crisis. It's already is actually.
Sure. I mean, and it's funny because people, I don't know how the education level of people about the condition here in Kenya is. I feel like in the U.S. people know the situation. They know, okay, you're too big. You need to exercise.
Yeah.
You need to eat properly. But yet, then you see these people, going to the shopping with the scooters and they can't even walk. And, I wonder how, like a program like what you guys are doing could help provide those daily, kind of recommendations like, hey, check your blood pressure. Okay, this is too high, man. You've really got to do something differently.
Actually, like the way we are modeled is actually to be doing exactly what you say, which is if you're a member, you get a dedicated nurse, a dedicated nutritionist, a dedicated mental health person, a team of doctors to be working with. And the goal of these people is really to keep you healthy.
Yeah.
If you are, say, overweight, the goal of these people is to ensure that you reduce your weight to levels that are good for you.
Yeah.
We've seen pretty good success where you see people losing kg just by intervention of a nutritionist, just knowing how to eat right. But then pulling back to the stigmatization, not the stigma, but rather the concept of people being overweight and whatnot. There are cultural issues as well, where you see for some socio places, you find someone being big is a sign of wealth.
Yeah. Well, and I've noticed that in Kenya, it's very interesting because you have like two groups of people. I see you have like some people that are very slight, very skinny, and then you have like these very big guys, big mamas in the village.
I'm eating well. I'm rich now, which then goes against the whole ethos of staying healthy. But please ensure you don't use that money to treat yourself.
Yeah.
Yeah. So there's this, social issues, dynamics around these things. And again, information is power when it comes to staying healthy.
Yeah. And with the program that you have, I mean, to become a member, does somebody pay like a membership fee? How do they join your program?
Good question. I'm glad you asked that. In the market overall, actually across the entire world, healthcare is the only one you pay when you go to the hospital, as opposed to paying a fee that people that then can enable people to give you services continually without you thinking about the cost element. So the way we currently are working today, we have first focused on taking care of people that have insurance coverage. And the reason for that is purely because we believe that if you don't have insurance coverage, health insurance coverage, you stay away from seeking care because of again the cost component issue. So we tend to give people health that have insurance coverage, and our services are very well priced. The cost at this stage, we are costing them at 6,000 annual fee.
Yeah. Okay.
Cheaper than a Netflix subscription, really.
Yeah.
Yeah. So you pay a subscription fee, and then from there you receive unlimited nutrition services, unlimited doctor consultation. But that fee also doesn't include the cost of medication and the cost of labs. That is not inclusive of that.
Sure. And so are these consultations, are they by the phone? How are you doing that for 6,000 shillings?
Let me talk about our channel of service delivery. We have about 4 channels: a call service, an SMS service for people with kadudus, that's what they call it, a WhatsApp line, and then we have a mobile app. And majority of the services that I'm talking about here, the nutrition, the mental counseling, the virtual doctor consultation, they in most cases happen over virtual means, where people are exchanging information via text, via calls, and then from there the recommendation. But then coupled with that, we also do the logistics component of it. If, for instance, it's taking your blood pressure, we'll give someone a blood pressure machine for 2 weeks. We collect all the samples we need. Then we put that device back and then give it to someone else. Curate, these devices in a way that it's cost effective, and at the same time it ensures that people are healthy. The other thing, if diabetes scenarios, we do glucometer strips for blood sugar, and then again we circulate that across. If it's for people with cholesterol issues, we do repeat profiling every other 3 months. Then
And I guess for the 6,000 shillings, is that kind of extra to take those cholesterol tests and everything?
For the blood pressure, for the blood sugar, for the repeat profiling, that's all inclusive.
So let's say I sign up for your program, and then let's say I've got a little extra weight. I want to get my kgs down. What would I do? I'd get on the app and maybe text the nutritionist and say, "Hey, I was thinking about eating this burger. Is that a good idea?" Something like that.
So you go on the web store, on the App Store or the Google Store. You download our app. It's called Antara. Once you download, you feed in the information, and then there is a screen that enables you to do what we call screening. Screening. It helps us understand what is your family history of around certain diseases. Also, what are your current health goals? In your scenario, it would be I want to lose weight, or I want to sleep better. And once you do that, immediately the app will prompt you to schedule a nutrition consultation. You schedule a nutrition consultation, and before you even schedule the nutrition consultation, immediately our system assigns you a personal nurse, assigns you a personal nutritionist, assigns you a personal mental health counselor, and then this then people are the gateway to you receiving care. The personal nurse in this scenario is the person who is responsible for ensuring that you're receiving all the services that you need. So you have booked the nutrition consultation. So at the due date, at the date of the consultation, our nutritionist will call you. And they'll take you through, understanding what are your current goals, what have you been eating, what are the issues, why is it even important to you to lose weight? And then from there, immediately after that, then they start working with you around
nutritional plan,
nutrition plans. So they even share with you meal plans. Here, for instance, if you're a bachelor, you might be eating a lot of fast foods.
Exactly.
And simply because you don't know how to, maybe you're too tired to think of what to cook. So even our nutritionist will work with you to figure out what are these plans, what are these meals plans that you can build that helps you stay fit. Or when you go to fast food, which are the best foods for you to be taking when you go to eat out, as opposed to just get a burger, get a pizza. It's that connection of making sure that you're eating that.
Oh, nice. Okay. So that's quite a comprehensive plan. So from your role, I guess you're the CTO, the tech guy who, I guess you kind of oversee the app side of things. Would that be the main portion of what you're doing?
Not
per se. Right?
The app is one component.
One component, yes.
Actually, a very tiny component.
Okay.
In this sense, I've talked about a team of doctors behind the scene. I've talked about a nutritionist. I've talked about a mental counselor behind the scene, and so many other doctors, which means that there is an entire medical health system behind the scene that is helping these people to do their work. And then, besides that, one of the issue you would notice is that it's not just one member that is being taken care of. There's so many members.
Yeah.
Each member has different need at any given time. So our system behind the scene then means that it's able to know and predict what is the most important action for each single member that need to be taken by a certain team member or care team member.
And how do you do this? Is there some kind of maybe AI involved at this point? Is this where we're getting into the
Yes.
the new world of AI, basically?
So AI has actually been a game changer
Yeah.
in this world because AI is those systems that are enable you to predict and see patterns, right? So yes, so there are AI components involved. There is a lot of what we call automations. It's more of small agents behind the scene, sniffing through someone's data and spitting out, do that action, do XY action, do this action, all the way to the member. By the way, it's not just the care team. All the way to the member saying, "Hey, XYZ member, please take a walk." Takes the stairs to as opposed to taking the lift.
Yeah.
Those kind of small bits of information. So it's AI combination, automations, so and so many other things. So my role here is really overseeing the build of the technology, the mobile app,
Being a part of it, yeah.
the call line, the routing mechanism around calls to the right person when you call.
Yeah.
Because you if you schedule a consultation for a nutrition consultation, it's important when you call you get routed to the nutritionist,
Right.
as opposed to the personal nurse. So it's all this behind the scene system build.
Yeah.
And then also the automation engine that is enables the care team to focus on what is important across the board.
That's very interesting. So, how did you get into, like, I guess you're one of the co-founders of the company, is that correct? And I guess this is like the second company you've co-founded? So how did you maybe you could start from, I don't know, maybe the first company and talk us through how did this happen?
So the first company was still, again, in healthcare, because this is really something I'm really passionate about. So the first company, we were doing what we call telemedicine, what people call today telemedicine.
Yeah.
You build a place where people can exchange messages, and then you can book a consultation with a doctor.
Sure.
A doctor at that time, you do that. So that was in the year 2016 thereabout.
Yeah.
2019.
That seems like kind of in the early days of the telemedicine coming on.
In fact, I think we were the pioneer of telemedicine in Kenya.
Yeah.
Through that company, we got to IC, and it was very noble to attempt to do such a thing. That's the first hand actually where the issue I talked about stigma that I came about, where some of the awesome moments was my co-founder then, Peter Park, delivering pregnancy test kit and HIV test kits at night. In some cases, in Wilson Airport, those tiny strips that only cost 250 shillings could be shipped to London.
Oh, wow.
So, and that was quite.
Yeah, that's crazy.
That was quite crazy. So, and as a result, I got to see firsthand how really issues around healthcare are really deep, and how we have so many systematic failures and issues around healthcare that really need to be organized. So I pulled that, for 4 years, give or take, and then in the year 2019, we decided to pull in other people on board, and then we merged. The company then was called Connect Health. We merged that company with another company called We Meet for Health, and we came together and then built now what we are building, the Antara Health.
So the companies are kind of related in a way, and they kind of what I mean. You mentioned that the first company y'all went through the Y Combinator process.
Yes.
How was that? Because I understand it's a pretty selective process, or a crazy experience.
Yeah, it's not, I would not call it crazy. I would say actually very fun experience in this sense.
Yeah.
Because you have this box seated for like, I think 12 minutes, and then you go for an interview for about 10 to 12 minutes, and in there you walk out with a yes or no.
Yes.
And you really answer very tough questions.
So it's kind of like the Shark Tank or something, I guess, but Well, you got 12 minutes, and then that's all the chance you get.
But then I was very privileged because right now I'm very proud of that moment because I remember then was the Sam Altman guy who is the founder of OpenAI, was the CEO then at YC, sitting next to him and having him interview you around.
That is pretty wild. Yes, I know I think the founders of SafeBoat. I don't know my company. I think they went to the YC at time range rate funds, and it didn't work out. I think they didn't make it, but I think they got a lot of good valuable advice from what I understand. So you had this, I guess, level of funding that came in, and so. But was this something you were always looking to do? I mean, were you an engineer before, and then how did it?
Maybe pull back a bit to my opinion a bit here. Yeah. When growing up, I did not have a chance to see computers. And then after, when I passed my primary school, I went to a high school in Thika. And it's the first time I came across a computer lab, and I was very fascinated by them. Because of in my head I was like, I will be the first one to learn this thing in my village. Because the options then were take a computer, take agriculture, take, I think there was called metals. And in my process of elimination, I was like, agriculture, I hated it.
I don't want to be digging in the ground.
Taking plowing in a scorching sun. Every other time. So I really could not take that route. So I took the computer option. And that was a big eye opener for me because that's then where the love for computers started.
Sure.
And I remember after computing in high school, I was really sure that that's what I'm going to keep pursuing. Even after actually finishing out high school, within the first few periods that people wait before they join campus, because of the pull to do more computers, I remember looking for a job in a cyber cave, just because I wanted to stay close to understanding for this.
Nice. Yeah. Well, that's good. And so, and did you start out your career just with some engineering jobs, things like that, or just like a individual contributor type of engineer?
Yes, I did. So as it's known, after you're done with a campus, you often tend to go for an internship. Right? So I went for an internship somewhere along Hurlingham, and I did that for 6 months. But then there was something in me that felt like I'm not learning fast enough as I should. So I learned enough. This is not as the pace that I need it to be. So from there, then I took off to do independent consulting type of work, where I got exposed to consulting companies in UK, companies in the US, companies in India, companies in all sort of world. Really, that's really gave me one, the independence of building software.
Sure.
Second, the organization on how you think of a system from top to bottom, because the kind of caliber of client I was working with were people that are just starting off a single company. Second, big organization. So that really gave me a mix of experience. Then during that time, I remember telling I have was the thing for people that have been here was a thing then. So I remember attending an event that I had. And in that event, that's where I actually met my co-founder.
Oh, nice.
And we decided let's do something in healthcare.
Sure. Well, I mean, okay, this is your, I guess, second company now. Our listeners probably would like to know, what's the inside scoop on these companies? Because I think a lot of the young people, they imagine, okay, I founded a company. You're walking around with a briefcase of cash, have your Bugatti. But what's kind of the real type of struggle that you have, when you kind of get started? Maybe you could tell us some stories about, without giving away the top secret information, I guess.
Well, yeah, this one is founding a company. On the outside looks very, very fun, but in the inside, it's a very tough, doubtful job that you have to do. Because at the early stage, for instance, you have to do everything. You have to be the marketing guy. You have to be the system support guy.
Yeah.
You have to be the sales.
Yeah, you're saying I'm the CTO. Why am I doing the marketing?
You have to meet your customers. So you have to be the UX UI guy if you're building a tech product. As fun story here, for instance, we would spend at the early days, we would spend majority of our time downtown in Eastleigh area meeting the Muslim community doctors, try to understand how they give care, So there's a role of that, I don't know that many things that you have to do at any given time.
Yeah.
But then the one thing that is it's fun though, in the sense that you wake up daily and you look around and there are just so many problems to be solved at any given time. And one of the challenges, how do you start this problem so that you solve the most strategic problem first, as opposed to the one that is burning faster, so that you as with the goal to really stay alive and keep pushing the business forward. So there's so many balancing act, really, I would say. And but then it's fun. Like for all it's worth, it's fun. But the most critical important is for you to really, for lack of a better word, be married to the problem, not the solutions. Because the problem is what keeps you pushing.
Right. So your passion for like helping people and providing good health is the key driver that keeps you going every day, I guess.
And that plus also, the way the system then, the right system to do that has so many things to be done. I'll give you an example. In a health system might end up having maybe 400 to 500 different data fields. So which means you're dealing with so many variables.
Yeah. So your problem space is very complicated.
Becomes very complicated, and that gives me a lot of fun in itself, because really I'm dealing with layers and layers and layers of complexity. Yeah.
All right, very interesting. And I guess outside of the company work that you're doing, I guess you also mentioned that you're mentoring in some like school training programs, tech training programs.
Yes. So education is crucial for me. It's really critical. I truly believe education is an equalizer. It's the one thing that makes society at par. And like looking back, for instance, for myself, I would see how was it for the free primary education that came about early in the days. I think it was year 2002, after the Kibaki government. Was it for that? I don't see how as a country would have gotten where we are. Yeah. So I'm a true believer of education and people having the right education. So as a result, then beyond healthcare, I have a passion for education. So I'm involved in this company by the name of Akira Chicks. What Akira Chicks does is training girls in underserved community to bridge the gap and push them towards the technical space. The challenge there being that there are very few ladies and females, one tech leaders, second technical ladies that are involved in this space for far too long, even though they were way early pioneers of technology at large. So I'm involved in ensuring that we keep building the momentum of having both ladies and men involved in technical world.
Yeah, I'm very familiar with the Akira Chicks. We just hired our first one of their graduates at my company, SafePhoto, here in January. So
I'm really glad to hear that.
Yes, we took on some intern, we were able to make a hire from the cohort. So yeah, it's a very interesting program. It's a good technical training, get hands-on experience and to support the growth of ladies in the community that they need that opportunity to really get great technical skills and get exposure to the workforce as well.
And for its word for the listeners, please hire from Akira Chicks. They are the best interns in tech field that I've come across. I'm not saying that because I'm a board member, but also saying that because these are the people that I also work with in my own company.
Sure.
And the way they grow and contribute is just enormous. Just to say, a testament to what they're able to do there. Besides tech space, I'm also in health education space around tech. I'm also involved in I'm a board member in a secondary school, and this is really crucial for me as well. It gives me a perspective of the upcoming generation, the kind of challenges they are facing, and myself being able to give back to the community at that level, at that age. So want to mention that.
Yeah, it seems like you really want to give back to, which is a great thing to be able to do. And so you see through the secondary school, what type of things do you see happening there? I mean, is it is it very different than when you were going through school?
Yes, it's very different. Like very different in so many ways. It's like
Yeah.
world apart. One is, we are living in a generation that have access to a lot of information.
Yeah.
Which then means sometimes they are very shallow in terms of what they focus on, as opposed to going deep on a space.
Yeah.
So I see that happening a lot, where people just know the top level details.
Yeah, a lot of different. They know the Chat GPT version.
Exactly, but they don't go deep.
Yeah.
And there is a lot of involvement there then to attempt to see. You just don't need to know. There is more to you going in depth as opposed to just staying shallow and assuming that you know. So there's a lot of that new world that is coming up there. Yeah.
Okay, that's pretty interesting. And yeah, I had a similar experience. When I first came to Kenya, I was operating schools, and I'd particularly operate schools in some of the slum areas, Kibera, the Reuben slum. Spent a lot of time in those areas, and I think it's pretty amazing to see the resilience that the kids have there in those areas when they're coming, you know, basically living in the level of poverty and yet being able to achieve like a lot of great things. I think. I mean, have you kind of seen that?
Well, I've lived in the slums.
Yeah,
so
yeah.
I can really tell you a lot
Yeah,
of.
yeah. That's the area you come from, I guess.
Yeah, so I grew up in slums, and I can tell you for a fact. Yeah, it's there is a lot to be done there. The escape away from crime, the focus point of people knowing where they are going, the self-awareness, the lack of mentorship in most cases. So I'm really glad to hear you that you're doing some of that work. That's really crucial because majority of those people, I can see myself back then. How that would have been very in handy.
Yeah.
So I'm really.
Well, it seems like the mentorship aspect is important, like you're saying, because it seemed like a lot of the kids, you could tell the children that, I don't know how you would say that, maybe a little naughty. Sometimes you could tell they were verging on that way they could go to crime or they could go to be very successful. And usually the ones that would go to crime, they're the ones who are could be the CEO of the company, right? The ones who are very well spoken and into different things, but they take the wrong path. And so, a lot of it was just having a consistent mentor to, hey, let's do this. Let's pull out the computer. Let's try to, learn coding. Let's do something that's different than the ways of the crime when you go home.
And that statement in itself, it's really hits home because in a sense, it's really hard for you to stay away from crime if you're living.
Yeah.
I'll give you a personal story here, for instance. At the time, I remember, back in the time when I was living in the slums, I remember us going for a concert somewhere along Antara. I don't remember the name of the garden there.
Yeah.
And there was this musician that was coming, and I think not Shaggy. He's a Jamaican guy, and the crew that I was with, I didn't know about it then, were really there to steal from others.
Yeah, exactly.
And there I was innocently with my buddies who are doing that.
Yeah.
And after the fact, I'm also meant to, after them stealing gadgets from others, the phones and all that, they are supposed to give you, keep them for you, or you keep the gadget they have stolen.
Yeah, so they'd try to hand to you and say, "Take this." Yeah.
Yes, take this. Well, I was very skinny, so you could not really guess I have them.
Yeah.
And after that moment, going home, I remember thinking to myself, if I continue hanging with these guys, chances are I will be a thug.
Yeah.
One way or the other. I'm not going to escape it.
Right.
I will be a thug.
Right.
And in hindsight, I'm glad then, from there then, with God's grace, I managed to start now pulling away from, because, instinctively I knew this is not the kind of life I want to eventually end up with.
Sure.
Yeah.
And I'm sure it's hard for kids in those situations where, okay, you're stealing some gadgets, you sell them, now I got some pocket money, get some whatever you're buying with it. I don't know, but I mean, I can see that pool is there when it's just kind of almost easy money, and it's hard to see the long-term vision maybe that you would have, like, hey, if I do the right thing, I could have a successful career, I could make even more money, I could be building the future of the country as well.
Yeah, though that's often not clear, really.
Yeah.
It's often not clear. It's really understanding what are the Like I'll probably speak a bit here on what why that pullback, why I had the mindset to pull away from them, for instance.
Yeah.
And it comes from the fact that I remember clearly back in class 8, no, class 5 actually, not class 8, maturing very early on.
Yeah.
And thinking to myself, I cannot be like the villagers around me.
Yeah.
Time is spent drinking alcohol, drinking smoking cigarettes and all that.
Yeah.
And that thought always was very live in my head every time I could come across these situations.
Yeah.
And it's not an easy thing to navigate. Really, it's not.
Yeah. I mean, I can't, yeah. I mean, it's hard to envision. I mean, what I would say, I grew up in kind of what they call the middle class, wasn't wealthy by any means, but, yeah, didn't really experience poverty. And, but I can see the struggle and I'm passionate about it. I think there's so much opportunity for kids that are in those situations. Which slum were you in, or were you moving around when you were young?
I was moving around. So
Yeah.
I grew up. This is after class 8
Yeah.
to Nairobi for the high school.
Yeah.
So stayed in Soweto area,
Yeah.
Saslam, DP, Kayole.
Yeah.
From there came to Isri area next to the Matare area. There's a slum along the Nairobi River called Kinyago. That's my operating ground.
Yeah.
And I love that. Yeah.
Well, I guess it's inspiring for the young people who are listening, who are in a similar situation right now, that even if you're in the slum, you could be the co-founder, CTO of a big healthcare company here, growing, and really, yeah, just leading in Nairobi. I mean, it's the future is possible in there, regardless of your situation. I think, like you mentioned earlier, everybody has their condition or situation. Everybody's dealing with a health condition. I mean, I think for the young people, what people get really down about is they think their condition is unique to them. I mean, there's probably 500,000, 1 million people in the slums now, right? So it's a difficult situation, but it's not unique necessarily.
Yes. And,
So-
and it's not, if you have the resilience
Yeah.
and the know-how of where really you want to go,
Yeah.
I think it's possible really for everyone, really.
Well, that's really, I find it very inspiring to see that you've been able to come through there. Well, do you have any other, from the startup world, I mean, any other kind of inside secrets or things that our listeners would like to know about, just the journey, or like,
A bit large. The question is a bit wide.
Yeah.
So the insights, it's the iterative process.
Yeah.
It's one of the things, the key thing here, where continually validating what you're building.
Yeah.
Again, as I said earlier, not getting married to the solution, but to the problem in itself, so that you don't keep doing more of the same thing, forgetting that it's not the app you're building, it's not the first MVP that is important. It's the problem. The problem that you're solving that is important, right?
Yeah.
So aligning that is the first insight I would probably be sharing, where it's really crucial for people that are building out there to realize that we need to keep building. Second of that is probably the coming together of people that are building with each other, because one of the problem I see around, especially in this market, is that startups, while we don't really build with each other as close as we should be. Where, for instance, if I'm building XYZ product, this product, I could easily sell it to another startup.
Sure.
That kind of branding of ensuring that we are validating and helping each other go to the next stage. I don't see that happening a lot. So,
Right.
The insight there being that I think it's crucial for all of us that are building companies and that are solving problems, that we keep building together and share thoughts and that kind of thing.
Yeah, I think that why this type of conversation is very critical, because we're trying to, as a community, see how we can help each other and solve some of these critical problems together. And particularly, I think when it comes to healthcare, it's one of the most frustrating, industries out there. I mean, in a lot of things, if you're, I don't know if your electricity, the power goes out. It's annoying, but you can get a battery, you can survive, a generator or something like that. But with your health, it's like a serious, very serious thing. I mean, I know even myself, um, I'm going to the U.S. for some surgery next week. So I need to have some eye surgery. So I have like some genetic conditions with the eyes, and there's a pretty typical, they call it cataract surgery. So I'm a young guy. You usually don't get cataract surgery at this age, but my eyes have deteriorated, and of course they can do cataract surgery here in Kenya. Um, and but my eyes are kind of a little unique. They need some specialty care. So I talked to the Kenya doctor here, and the surgery is still very expensive, but they say we kind of guess. Yeah. We can't be certain. We're going to make some guesses.
That's scary already.
Now the price it is still pretty expensive, but then luckily I come from the U.S., so I have access to the U.S. So I go talk to the doctor in the U.S. and they said, well, the price is 10 times what you're going to pay in Kenya, right? But we don't guess. We have the machines. We have this. So I decided, what's the eyesight? Okay, I'm going to go to the U.S. to, it's not like getting your finger worked on or something. So, but it's just so frustrating, the whole process, because even, I've lived here for 12 years, and the insurance companies in the U.S., they won't. Once you say you're going to Africa, the insurance is like, no, sorry. Like, you can get insurance, but it's, then they're like, well, we won't cover you in the U.S. because now you stay in Africa. Like, what if you get dengue fever, or something,
Stigmatization again.
Yeah. But I mean, so you still you pay for insurance, but then the insurance is like, they won't cover the money. So I have to make these tough decisions. And so, yeah, so I finally decided, okay, I'll go back to the U.S. And then, of course, we're dealing with the insurance companies and trying to get them to, like, I need you to pay this money. I don't have the money to cover this crazy surgeries. Yeah, it's daily a battle. Everything that you do in the healthcare, and people are really suffering here. I know so many people, they're in the slum or the village, and they need something like you mentioned. Okay, okay, your mom needs TB medicine. Yes. Okay, I'm sure it costs some money to get TB medicine. Where's the money coming from?
Or even the basic cars, where we get this medication. That in itself is also a problem.
People who have a condition, and it could be like an expensive condition. Maybe it's going to cost 100,000 shillings to fix it.
Yes.
Okay, but who has 100,000 sitting around to cover? For these things. Who plans for those things, so that you can, I guess, arrange the family to contribute, maybe, or I don't, are we going to save grandma? I don't, I don't.
So healthcare is that one industry that has been left behind for far too long in terms of technology advancement.
Yeah.
And well, in hindsight now I understand.
Yeah.
And the why here, from my perspective, is that there are so many stakeholders involved in it.
Yeah.
Just take the example, for instance. For you to eventually be lying doing that surgery, you have maybe interfaced with probably 10 or so different type of health service providers.
Yeah.
From the receptionist.
Oh yeah. To this reception, go here, go.
There is a row of layers and layers of complexity. And if you are building a healthcare, if you want to streamline this, you have to figure out where is the middle ground where all these stakeholders can interface and communicate with each other effectively. The reason why, for instance, maybe the insurance in the US will not cover you being in Africa is probably misinformation, in the sense that they don't understand what's the current emerging health issues within the continent or within Kenya. They probably are still relying on the old data that they had.
Oh yeah, 20 years ago. Yeah, they think I'm going to get yellow fever or something,
Exactly. Well, the chances of you getting that are negligible compared to you getting something else that is probably more than.
Yeah, exactly. Yeah, I mean that's that. I mean, everything in the U.S., they won't cover life insurance. You can't get life insurance. You can't get anything. The minute you say Kenya on the form, it's like, you're done.
I'm really glad that you gave up on that to me. Such a selflessness.
Yeah, and it's kind of tricky, because I mean, I guess you can get the local providers as well. So, and there's a lot of good new upcoming insurance providers, and things in country. So hopefully, you try to balance all these things out, and it just, what I noticed is the healthcare costs in the U.S. is so high compared to Kenya. I mean, it's getting to the point where it's out of control. When I was a kid, it was expensive, but it was manageable. I guess there's some things that are manageable. It's like if you can buy a house, okay, somebody can probably raise 200,000 for a house. Once you start talking of 20 million, then people are, I don't know. So healthcare costs. I was researching, and they were telling me for a family, I've got kids and my wife and everything. They told me, okay, to insure your family in the U.S., you need, I want to say it was about the equivalent of 3 million Kenya shillings a year just to get health insurance. Of course, you can't pay that, right? No reasonable person could pay that. Nobody has that. Nobody has that type of job, right? So, you know, so I don't know what people. I think people are just. I don't know what they do.
Even here, like the insurance penetration is really low.
Yeah.
I think it's the private insurance space. I think it's about 3% or less. The people that have coverage of it is very, very low in the industry.
Right. Oh yeah. I mean, it's just gotten out of control.
But for the the price on the health on the US side, one of the things I've had for the longest time is that the reason why it's expensive is because of drug discovery. I'm not sure whether that's true.
Yeah.
I don't. Yeah.
Well, and the main problem I think for the U.S. is because of the lawsuits in the so like for instance, I go for this eye surgery. If the doctor messes up and I go blind, let's say, then all of a sudden I sue the doctor. Okay, now I'm blind. I do tech work, so now I can't do my tech work anymore. Now I need how many ever millions to so now the price is and people were winning these lawsuits because of the American legal system. I mean, you can claim the doctor messed up and made a mistake or didn't advise you correctly of the risks involved of doing this, and
that's quite insightful.
So then they have to keep increasing the prices, but it's just crazy. After a while, it just gets too much.
Does it mean that the doctor gets paid what could potentially be legal fees upfront?
Well, what they do is let's say if somebody and the doctors make a very high salary, but let's say their salary is I don't know 10 million. They get a salary 10 million. Well, 5 million of that they turn around and pay directly to the insurance to cover their legal fees, because when they get sued, if they lose the lawsuit, they have insurance to pay those fees. So they're kind of doubling the cost or more, so that they have to pay their insurance, and so the legal insurance keeps getting higher and higher. I mean, I'm not an expert in the medical, so I don't know exactly, but that's sort of what I understand is happening.
Very insightful, very insightful. I wonder, but it seems easily regulated, but can be easily be regulated though in policy from the government.
Yeah, I mean, I think any of these things, the government could play a critical role in the U.S. And of course, I don't get a lot into the politics because for one, I don't understand the politics that are involved or like what's going on behind the scenes. But we do know the system's broken, and we know that change could happen if the right people step up and do the right things.
If they had the right intention to begin with.
Yeah. So maybe to the politicians listening, do the right thing. We know the right things to do, I guess. We just don't want people dying. We want, people want affordable health care. People are suffering and they need assistance, so that's, and I guess, opening up the regulations so that, companies like yourself can operate in a good way that you can get your services to people and
Yeah, like when I, for instance, look at our government, for instance, not get into the politics world.
Right, sure.
One of the simplest things they could possibly be doing around, healthcare, making it more accessible and more affordable, is as simple as be the builder of policies. Stop doing the implementation.
Yeah.
Because when it comes to execution, often, it's never get followed up to the last bit of it. But then, as we all know, what the the people that are excellent at executing are the private sectors, not the government in that sense.
Yeah.
So it's more of like creating those lanes, separating those lanes clearly, and ensuring that if the government focus on policies and then ensures that you have the right implementers, that you are following all the through to the impact that is being sought.
Yeah, that would be very helpful. I think if you guys keep doing what you're doing and keep building out your systems and connecting the hospitals together, I mean, I think it'll really be saving some lives. And then this idea of preventative maintenance is a huge thing as well.
It's a huge thing. We just to share some success stories on our end. Like we've seen huge success, like really huge success, where, for instance, one of my friends' mom, who we take care of, being able to walk again after having dealt with arthritis for so long.
Yeah.
But just by doing small life modification things of what you are eating, how you are sleeping, the basics really. The second is making sure that we don't have a lot of wastage in the system, where people are going to hospitals for things that really could be prevented upfront. Here another example would be, if you're hypertensive again, what happens with a hypertensive person is that it starts slow. Then eventually it end up becoming a kidney issue. It end up becoming a stroke issue. It end up becoming, like, it's so many layers. And then you can look at how taking early interventions saves you millions and millions of money of ICU, hospitalization, HTU kind of rising, and unnecessary medication that you eventually end up taking.
Yeah.
So we've seen a lot of success of members that we taking care of, moving from really high blood pressure to a manageable blood pressure. That then, and also as dissemination of information around their nutrition, their sleep, and all sort of like life modification. Then has a huge impact to themselves. This same information they're able to share with their families and with their grandmothers, their grandfathers, and with their community at large. And as a result, then you see huge impact happening.
Sure. With your company, like, how do you see it scaling? Like, what's the future that you have? Are y'all looking to go more to the mass population? Are you looking to go more into the village area? Like, how are y'all going to expand? Like, what does it look like?
One of the things that we do is, being very crucial on looking at what we call doctor to patient ratio, doctor patient to nurse ratio, where we optimize our system to be able to, for one nurse to take care of maybe 1,000 people or 2,000 people, and then we keep moving from that angle. So the scaling the feature there is more of building more quality checks in place, building more AI tools around that are supporting our care team to take care of more members, and then building the system and scaling it outward both in Kenya, in other markets. So really, we have built a system that I believe truly today it's capable of taking care of 100 to 100,000 people at any given time.
All right. Well, that's pretty exciting. That's a big tech challenge. Like, what type of tech challenges do you see with like scaling something like that?
One is of course the obvious challenges around data security, information overload to both the care team and the rest, because we are pulling a lot of insightful information across each segment. The other challenge is coordination of care becomes a problem, because there are so many people involved, and being able to make sure that things are not falling through the cracks, it's a huge problem overall, right?
Sure.
And also making sure that the nurse, the nutritionist, the doctor are not overloaded with members. So it's that tiny balance of technical challenges behind the scene. And then beyond that, it's the cost of the same, right? Because more members, more CPUs, and more money to pay in terms of server costs and all that.
Yeah, and that stuff is not cheap here.
Exactly, yes. And now also going to the world of AI, more things you are doing to the models, more training of the models, cost more money.
Yeah, exactly. It gets kind of crazy pretty quickly.
Yeah.
Sure. Well, I guess a lot of our listeners, they are probably thinking about how to start their company or learn more about healthcare? Like, what advice would you give to these young people, that are looking to?
Well, if they're already thinking about it,
Yeah.
just don't procrastinate.
Yeah.
Get started like yesterday. All it takes is getting started, really. And then you clarify steps on them. Sitting on the idea, is not helpful. So the first thing is get started.
Yeah.
Don't be afraid, this idea is being implemented by someone else. They all have different ways of approach of that problem. Your approach could be interesting, that it creates more value than the approach. So I tend to think the market is big for everyone. So really just get started and then keep validating and keep going. Yeah.
All right. Well, great. I think that's all the questions I have for you. I mean, is there any other thing you want to go over or be sure that our listeners know about?
No, I think that's good enough for today. Maybe, yeah.
Okay. Well, it's been really great talking to you, Julius, and I hope we can really do this again, and we'd love to learn more about what you guys are doing, and wish you a lot of success with the company. And we know we're going to see some big things coming out of Kenya. Hopefully, your company's going to, go global, I guess would be, we'd say, and eventually in the U.S. even, you can help me out with my the coordination of care issues that happen in the international context. I know it takes some time, but I think you guys are doing the right thing, and it's great to see people giving back to the community. So thanks for joining us today, and really appreciate it.
Really appreciative of you hosting me. It was really a great honor to speak to your audience, and for sure, I'm really looking forward to more of this.
Okay, and for those of you listening, remember, go out there and get the gold, as we've been told. Get out there, just do it. And we look forward to all the success you're having. So thanks for joining us on Nairobi Gold Rush. We'll talk to you next time.